Okay, greetings to each and everyone. This is Dr. Mark Jobertson Balawed, an infectious disease physician, presenting to you a case of a nematode infection, together with the two other doctors, Dr. Crystal Trinos and Dr. Romelyn Gardigo. So without further ado, let's proceed. Okay, so for our table of contents, we have first the introduction. We'll be introducing you the nematode infection and give you its background on how our patient might have get the nematode infection. And next is the diagnosis on how the patient is diagnosed with nematode infection. And for the next one is the last, which is the treatment. These are the possible treatments given or prescribed by the doctors or experts. Okay, so for the introduction of nematode infection, another term of Dracunculiasis or cutaneous larva migrans or the creeping eruption. It has a scientific name of Dracunculus medinensis and has a common name of guinea worm. This guinea worm is a parasite that enters the human body in contaminated drinking water, grows for almost a year, and emerges through a burning blister in the skin. Guinea worm disease, or the GWD, also known as Dracunculiasis, is a preventable waterborne parasitic disease affecting rural parts of developing nations of South Asia and South Africa, which do not have the access of safe drinking water. It is thought to have existed in India for several thousand years, like Banwari Lal, a 25-year-old man from the Jodhpur district in Rajasthan, and it is from India. He has reported case of guinea worm disease. In July 1996, however, subsequently, three more cases were reported from parts of Rajasthan. Today, the GWD is seen only in some communities in remote parts of Africa and India. Annually, number of reported cases worldwide has been declined from approximately of 900,000 in 1989 to only about 3,000 in the year of 2009 and about 1,000 in the year of 2011, reaching to 2 to 4 in Asia, is considered as free of the disease. And the disease is not fatal but causes considerable disability. There is a pain and difficulty in moving because of complications of the disease. As you can see, there we have is the data, which countries which is being affected the most when it comes to the GWD or the guinea worm infection disease. So the life cycle of guinea worms, first, as you can see in the description, we have the water. It has the containment of infected copepod, which is the larvae. So the first process of the cycle of guinea worm is entering the body. So a person drinks water containing copepods with the tiny crustaceans related to shrimp and crabs that carry guinea worm or larvae. So as you can see in the description, we have there the water being consumed or drink by the human, and it has an infected copepod, which or the crustaceans, and it has the larvae on it. Okay, so upon consuming the infected copepod, the water which is being consumed by the human, the next that might happen is multiplying. The microscopic worm larvae are released from the copepods, which is the worms that mature into adults and make in the person abdomen. So as you can see in the description, it becomes more and more and multiply more, which is the guinea worms. There we have in the description the male and the female ones. And after that, after they multiplied, they grow, of course, the third ones. Unknown to be human victim, female worms migrate to other parts of the body, usually in the lower limbs. As you can see in the description, it do live in mostly of the lower limb, which is this part. Okay, so just like what I have said earlier, when it comes to the growth of the guinea worm, it grow on the lower limb part. And as you can see in the description, we have here the female worm growing on the lower limb of the person. And for the fourth process is that the living of the body. A year after infection, a full-grown female worm, up to 3 feet long, creates a painful blister on the skin. So you can see it on the description. It emerged the guinea worm on the lower limb of the person that has the guinea worm. And as of the pip process, which is the infesting the water, the affected person goes to the water to alleviate the pain and sitting heat of the blister. The cool water triggers the mother worm and to emerge and release larvae into the water. As you can see in the description, there are more larvae on the water. And for the last process of the cycle, which is the sixth one, the infecting copepods. Tiny crustaceans called copepods ingest the worm larvae, and the disease spreads if other people drink the water. As you can see in the description, they include the look of the infected copepod, or considered as the crustaceans or the larvae that it has or it contains, to know that it is contaminated with guinea worm. So that's all for the cycle of guinea worm. Okay, so next we have is the profile of our patient. As you can see, we have here a 4-year-old named Rafia. He receives a treatment for an infected guinea worm at a hospital in Sebelegu, Ghana, when the Carter Center began working on eradication in 1986. Ghana ranked second in the world in guinea worm cases. In 2010, Ghana recorded is the last case of disease in 2010 and was certified guinea worm free by the World Health Organization in 2015. And Rapia was the far at last case of the nematode infection in Ghana. And Rafia's previous health doesn't show any kind of illness as a background of his medical medications and other health backgrounds of Rapia, the kid with is confirmed with a diagnosis of uh, guinea worms. Okay, so to discuss more about our patient, Dr. Roman Gardigo will proceed the following.
For the diagnosis, his symptoms usually start when the worm tries to break out through the skin. A few hours to days before the worm emerges from the skin blister. The person may develop pain and swelling in the area associated with fever. Occasionally, proteins released by the worm can cause an allergic reaction, leading to breathing difficulty, an itchy rash, vomiting, and disabling pain. Nearly all the worms come out through the legs and feet, but they can emerge from other parts of the body as well. Guinea worm disease, also known as Dracunculiasis, is typically diagnosed through clinical examination, especially when the adult worm is protruding from a skin blister. The clinical presentation of this disease is so typical and well known to the local population that it often does not require laboratory confirmation. However, if necessary, an examination of the fluid discharged by the worm can reveal rabiditiform larvae. There is no serological test available for disease. So that for the treatment, Dr. Crystal will explain furthermore the treatment and prevention of guinea worms disease.
There is no medicine to cure guinea worm disease and no vaccine to prevent it, yet it can be stopped. The treatment in guinea worm disease is the management of guinea worm disease or GWD. This treatment involves removing the whole worm and caring for the wound in general. The only treatment is to remove the worm by winding it around a small stick and pulling it out little bit at a time as it loosens. Sometimes the worm can be pulled out completely within a few days, but it may take up to several weeks or even a month. So here's the optimal management of GWD involves the following steps. First, the infected person is not allowed to enter drinking water sources. Next, the wound is clean. The affected body part may be immersed or soaked in water. It is far away from any water source to prevent contamination. To encourage the worm to contract and release larvae, emptying the worm of larvae may make removing the worm easier. The worm is then wrapped around a rolled piece of gauze or stick to maintain some tension on the worm and encourage more of the worm to emerge. This also prevents the worm from slipping back inside. Then, gentle traction is applied to the worm to slowly pull it out. Pulling stops when resistance is met to avoid breaking the worm. Because the worm can be as long as 1 meter in length, full extraction can take several days to weeks. Afterwards, topical antibiotics are applied to the wound to prevent secondary bacterial infections. The affected body part is bandaged with fresh gauze to protect the site. Medicines such as aspirin or ibuprofen are given to help ease the pain of this process and reduce inflammation. These steps are repeated every day, and from the prevention of guinea worm disease, treating water in some areas, workers treat drinking sources with a mild larvicide to kill the tiny crustaceans called copepods that carry guinea worm larvae. First, bathing facilities. Bathing facilities help to promote good hygiene practices such as regular hand washing and body cleansing, which are essential in preventing the spread of guinea worm disease. And providing access to clean and safe bathing facilities, individuals can reduce their risk of contracting this debilitating disease. Next is fresh bedding. Fresh bedding also promotes overall hygiene and health. Clean sheets and blankets can help prevent other infections and diseases, providing a comfortable and safe sleeping environment for individuals at a risk. Lastly, healthy food for themselves and their families is prioritizing healthy eating habits for oneself and their families is crucial in preventing Dracunculiasis infection. By making smart food choices and practicing proper hygiene, individuals can safeguard themselves against a debilitating parasitic disease. So that's all.